Narcolepsy. Hello, I am Dr. Naras Bhatt, board certified sleep specialist. We're going to learn what is narcolepsy, the causes of narcolepsy, the pathophysiology of narcolepsy, symptoms and impact of narcolepsy, diagnosis of narcolepsy, and treatment of narcolepsy. So, what exactly is narcolepsy? Narcolepsy has four key features that lead to unexpected sleep attacks. The four key features are 1. Excessive daytime sleepiness, 2. Cataplexy, 3. Sleep paralysis, 4. Sleep hallucinations. So, excessive sleepiness is the most disabling symptom of narcolepsy, and it can be brief or it can be prolonged naps, like up to 2 to 3 hours. Sleep attacks occur so suddenly and they are irresistible without any warning. Cataplexy is abrupt loss of muscle tone while you are awake, and that can happen usually by emotional outbursts of laughter, anger, or excitement. Sleep paralysis is a sudden loss of muscle tone that lasts seconds to minutes as you fall asleep, which is called hypnagogic, or as you wake up, called hypnopompic, and the recovery is immediate and complete. Sleep hallucinations is a dream-like imagery, again as you fall asleep or as you wake up, and it could be multisensory, like visual, tactile or touch feelings, or kinetic or movement feelings. So, what causes narcolepsy? The current thinking is narcolepsy is due to the deficiency of hypocretin in your hypothalamus, hypocretin 1 or hypocretin 2. Normally, as you fall asleep, you have sleep latency, and then you go through REM sleep after about 90 minutes, and the REM cycle goes for about 4 to 5 times throughout the night. When you have narcolepsy, the REM sleep occurs as early as 8 minutes or less of your sleep onset. That is called sleep onset REM. In narcolepsy, the sleep occurs so quickly, right at the onset of sleep, as I mentioned, and the lack of muscle control, dreaming, and sleep paralysis that normally occurs during REM sleep also occurs sooner and at other times in narcolepsy, even when you are not asleep. The classic symptoms of narcolepsy are commonly called as tetrad of narcolepsy. Once again, to revisit excessive daytime sleepiness. This is usually the first symptom to appear. It generally persists throughout life, and they fall quickly into sleep and wake up suddenly. They have vivid dreams and dream even when they are asleep only for a few seconds. The cataplexy episodes are loss of muscle function ranging from slight weakness to complete collapse of the body. These episodes may be triggered by emotions such as laughter, coughing, anger, frustration, etc. They last from a few seconds to few minutes, and the person remains conscious throughout the episode. Sleep paralysis, once again, is a temporary inability to move or talk while walking or falling asleep, and it lasts for a few seconds to minutes. Hypnagogic hallucinations or hypnopompic hallucinations are again dreamlike states when as you fall asleep and as you wake up. By the way, the classic tetrad symptoms may not occur in every patient. What are the lifestyle impacts of narcolepsy? It affects you by increasing the incidence of accidents, depression, social isolation, weight gain rather, and decreased quality of life. Narcolepsy can be dangerous because you may fall asleep while driving, operating machinery, or while using sharp objects. Narcolepsy can affect mental health by giving you depression, anxiety, or memory, attention, and concentration problems. Narcolepsy can have a negative impact on relationship. Spousal relationships are often strained. Sleepiness can affect your sex drive. Professional relationships become strained as well because co-workers may find it amusing, job performance may be affected, and superiors may assume that the patient is lazy or faking. ICSD-2, International Classification of Sleep Disorder 2, diagnostic criteria of narcolepsy are three main findings. 1. Excessive daytime sleepiness that lasts for more than 3 months. 2. A definite history of cataplexy triggered by emotions. 3. The sleep study shows that the mean sleep latency, that is the how long it takes you to fall asleep, is 8 minutes or less. And then there are 2 or more sleep onset, REM sleep or dream sleep right at the onset. Alternately, the brain CSF finding, it is a medical test, may show that the hypocretin 1 level is 110 or less. How do you treat narcolepsy? You treat it by lifestyle changes or medications. Lifestyle changes specifically refers to good sleep hygiene like regular sleep scheduling, avoiding caffeine in the afternoon, etc. Scheduling short naps 2 to 3 times a day to control excessive daytime sleepiness. In school-age children, they should get doctor's note so that the teachers permit these scheduled naps. Avoid activities that would be dangerous if you had a sudden sleep attack. Activities such as driving, using heavy machinery, climbing ladders, using sharp objects, etc. So now let's look at the medications. We use medications to reduce the sleepiness. That is, those are the central nervous system stimulants, such as Provigil or modafinil, Nuvigil or modafinil. And then we use medications to consolidate sleep at night. That's called Xyrem, which is called sodium oxybate. And that drug is used when narcolepsy is associated with cataplexy, increased sleepiness during the daytime, and disrupted, fragmented sleep at night. Then we use REM suppressors that suppress the REM sleep. The drug therapy of REM suppression helps you to reduce cataplexy, hallucinations, sleep paralysis, etc. And these category of drugs are usually antidepressants that suppress your REM sleep. Serotonin, norepinephrine reuptake inhibitors like Effexor are used, and norepinephrine reuptake inhibitors like Strattera or atomoxetine are used as well to suppress your REM. Selective serotonin reuptake inhibitors like the commonly used antidepressant Prozac or Zoloft are used as well. And older tricyclic antidepressants like protriptyline, imipramine, desipramine, and clomipramine are used as well to suppress REM. We recommend our patients to get more information about narcolepsy from Narcolepsy Network.